A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a dramatic move that has sent shockwaves through the political landscape, opposition leader Peter Dutton has announced plans to slash $24 billion from public service spending. This bold initiative is aimed at funding a $9 billion boost to Medicare, a decision that could potentially reshape the future of healthcare in Australia. Dutton's strategy involves targeting the 36,000 additional public servants added by the Labour government since they took office, which he argues has led to an unnecessary increase in bureaucracy costing taxpayers $6 billion annually. He insists that this reduction will enable the coalition to offer free GP visits while maintaining a commitment to smaller government. Under the Labour Party, there are 36,000 additional public servants, which costs $24 billion over the forward estimates. Our program totals $9 billion over that period, so we've identified the savings, Dutton stated confidently. The coalition's decision to match Labour's $8.5 billion bulk billing incentives for GPs is a strategic move designed to counter the government's criticisms of Dutton's record as health minister, where he faced backlash for attempting to cut rebates and introduce mandatory co-payments. This latest announcement puts Dutton under pressure to clarify how he plans to reduce spending without compromising essential government services, especially with other ambitious promises on the table, including a nuclear power energy plan. Dutton has faced accusations from Prime Minister Anthony Albanese, who claims that Dutton is merely following Labour's lead without presenting his own policies. Dutton, however, maintains that he is well-versed in the details of his Medicare proposal. Political analysts suggest that matching Labour dollar for dollar is a calculated move to neutralize a contentious issue ahead of the upcoming election. Andrew Carswell, former media chief to Scott Morrison, remarked, "It neutralizes a tricky political issue for the coalition and blunts the attack of the Albanese government. They're political equations, not policy considerations." Despite the bold claims, Dutton has not specified which departments will be affected by the cuts. Eliminating 36,000 public servants equates to nearly 20% of the public service, raising concerns about the impact on essential services. Significant increases in public service staffing have been seen in various departments, including the National Disability Insurance Agency, which added approximately 3,500 jobs to combat fraud and overpayments. The Defense Department has also seen an increase of 2,800 positions, and the Health Department has added nearly 2,500 staff to deliver urgent care clinics. Dutton has promised that frontline services will remain untouched, stating, "We are not cutting frontline positions. I want more money going to frontline services, health, and education." However, he has previously suggested cuts to cultural diversity and inclusion roles, which employ only a handful of staff across departments. In response to Dutton's proposals, Finance Minister Katie Gallagher defended the government's budget management, highlighting a $200 billion improvement and 2 recorded surpluses. She indicated that further savings and spending promises are on the government's agenda, particularly in the housing sector, where Albanese emphasized the need for increased housing supply during his campaign in the Labour-held Melbourne seat of Chisholm. As the political landscape heats up, the implications of Dutton's plan remain to be seen. Will his approach to public service cuts resonate with voters, or will it raise concerns about the future of essential government services? As the election approaches, the debate over healthcare funding and public service efficiency is set to take center stage. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.